Hey everyone, welcome back to the channel. Quick question, how many of you reached for a painkiller this week because of a headache? If you raised your hand, you're definitely not alone. Headaches are one of the most common health complaints in the world, affecting millions of people every single day. But here's what most people don't realize: not all headaches are the same. And that pain in your head could be your body's way of telling you something important. Some headaches are just minor annoyances that go away with rest, while others can be signs of serious underlying conditions that need immediate attention. Today, we're going to break down everything you need to know about headaches, the different types, what causes them, warning, signs you should never ignore, and most importantly, how to prevent and treat them. So if you're tired of constantly dealing with head pain and want real answers, stick around because this information could literally change your life. Understanding head pain. Before we dive into specific types of headaches, let's understand what's actually happening when your head hurts. Here's an interesting fact: your brain itself doesn't feel pain because it has no pain receptors. So when you have a headache, the pain is actually coming from the tissues, nerves, and blood vessels surrounding your brain. The pain can originate from your scalp, the muscles in your neck and head, the blood vessels in your skull, or the nerves that connect to your brain. Headaches are generally classified into two main categories: primary headaches and secondary headaches. Primary headaches are conditions where the headache itself is the problem, not a symptom of something else. These include tension headaches, migraines, and cluster headaches. Secondary headaches are caused by underlying conditions like infections, injuries, high blood pressure, or other medical problems. The pain is a symptom telling you that something else is wrong in your body. Understanding which type of headache you're experiencing is crucial because it determines how you should treat it and whether you need to see a doctor urgently. Type 1. Tension headaches. The most common type of headache that affects about 80% of people at some point is the tension headache. If you've ever felt like there's a tight band squeezing around your head, or you have a dull, aching pain on both sides of your head, you've probably experienced a tension headache. These headaches typically cause mild to moderate pain that feels like constant pressure or tightness across your forehead, the sides of your head, or the back of your head and neck. Tension headaches happen when the muscles in your head, neck, and shoulders become tense and contract. This muscle tension can be triggered by stress, anxiety, poor posture, eye strain from staring at screens for too long, lack of sleep, skipping meals, or even clenching your jaw. Many people who work at desks or computers all day suffer from chronic tension headaches because they're sitting in the same position for hours with their neck and shoulders tensed up. Emotional. Stress is also a huge trigger. When you're worried or anxious, you unconsciously tighten the muscles in your head and neck. The good news is that tension headaches usually respond well to over-the-counter pain relievers like ibuprofen or acetaminophen. But relying on medication all the time isn't the answer. The key to preventing tension headaches is addressing the root causes, managing stress through relaxation techniques, improving your posture, taking regular breaks from screens, getting adequate sleep, staying hydrated, and doing gentle stretching, exercises for your neck and shoulders. Some people find relief through massage, hot or cold compresses on the neck, or practicing stress reduction techniques like meditation and deep breathing. Type 2 migraines. Now let's talk about migraines, which are much more than just bad headaches. Migraines are a neurological condition that affects about 15% of the global population, and they can be absolutely debilitating. If you've never had a migraine, imagine the worst headache of your life, combined with nausea, vomiting, and extreme sensitivity to light and sound. That's what millions of people deal with regularly, sometimes for days at a time. Migraines typically cause intense throbbing pain that's usually on one side of the head, though it can affect both sides. The pain is often so severe that it interferes with daily activities. People can't work, can't take care of their families, and sometimes can't even get out of bed. Many migraine sufferers experience what's called an aura before the headache starts, which can include visual disturbances like seeing flashing lights, zigzag lines, or temporary blind spots. Some people experience tingling in their face or hands, difficulty speaking, or feeling confused. Migraines are believed to be caused by changes in brain activity that affect nerve signals, chemicals, and blood vessels in the brain. Common triggers include hormonal changes, especially in women during menstruation or menopause. Certain foods like aged cheese, processed meats, chocolate and alcohol, food additives like MSG, caffeine, withdrawal, stress changes in sleep patterns, bright lights, loud noises, strong smells, and even weather changes. Some people can predict their migraines based on these triggers, while others can't identify any specific cause. Treatment for migraines often requires prescription medications that work specifically on migraine pathways in the brain. Over-the-counter painkillers usually don't work for severe migraines. Preventive medications can reduce the frequency and severity of migraines if you experience them regularly. Beyond medication, identifying and avoiding your personal triggers is crucial. Keeping a headache diary where you track when migraines occur. What you ate, your sleep patterns, and stress levels can help you identify patterns and triggers. Type 3. Cluster headaches. Let me tell you about one of the most painful conditions known to medicine: cluster headaches. These are relatively rare, affecting less than 1% of the population, but they're so painful that they're sometimes called suicide headaches because of how unbearable the pain can be. Cluster headaches come in groups or clusters, hence the name. You might have multiple attacks daily for weeks or months, followed by periods of remission where you have no headaches at all. The pain from cluster headaches is excruciating and focused around one eye or one side of the head. It comes on suddenly and intensely, often waking people up from sleep. The affected eye becomes red and watery. The eyelid might droop and the nostril on that side might become stuffy or runny, unlike migraine sufferers who want to lie down in a dark room. People with cluster headaches often feel restless and agitated, pacing around because the pain is so intense. Each attack typically lasts 15 minutes to 3 hours. The exact cause of cluster headaches isn't fully understood, but they seem to be related to abnormalities in the hypothalamus, the part of your brain that regulates your body's biological clock. They're more common in men, especially those who smoke or drink heavily. Certain times of year seem to trigger clusters in some people. Treatment requires specialized medications. Pure oxygen therapy through a mask can stop an attack within 15 minutes for many people. Prescription medications like triptans can also help, and preventive treatments can reduce the frequency of attacks during cluster periods. Type 4. Sinus headaches. Many people think they have sinus headaches when they actually have migraines, but true sinus headaches do exist, and they occur when the cavities in your head called sinuses become inflamed and blocked. This inflammation causes pressure and pain around your forehead, cheeks, and eyes, and the pain typically gets worse when you bend forward or lie down. Sinus headaches are always accompanied by other symptoms of sinus infection, like thick discolored nasal discharge, reduced sense of smell, fever, and facial swelling. Sinus headaches are secondary headaches, meaning they're caused by an underlying problem, usually a sinus infection or sinusitis. The sinuses are air-filled spaces in your skull, and when they become infected or inflamed due to allergies, colds, or bacterial infections, they fill with fluid and mucus. This buildup creates pressure that causes pain. The key difference between a sinus headache and other types is that sinus headaches always occur with clear sinus symptoms, and they improve when the sinus infection is treated. Treatment for sinus headaches focuses on treating the underlying sinus problem. This might include decongestants to reduce swelling, nasal saline rinses to flush out mucus, steam inhalation to help drainage, and antibiotics if there's a bacterial infection. Pain relievers can help with the discomfort, but they won't solve the problem. If you have recurring sinus infections and headaches, you might need to see an ear, nose, and throat specialist to check for structural problems in your sinuses or chronic conditions, like allergies that need long-term management. Type 5. Secondary headaches. Warning signs. Now this is really important. While most headaches are harmless primary headaches, some headaches are red flags indicating serious medical conditions that need immediate attention. Secondary headaches can be caused by infections like meningitis or encephalitis, brain tumors, bleeding in the brain, stroke, extremely high blood pressure, carbon monoxide poisoning, head injuries, or temporal arteritis, which is inflammation of blood vessels in your head. Here are the warning signs that your headache is an emergency and you need to seek medical help immediately. If you experience the worst headache of your life that comes on suddenly like a thunderclap, this could indicate bleeding in your brain. If your headache is accompanied by fever, stiff neck, confusion, vision changes, difficulty speaking, weakness or numbness on one side of your body, or seizures, these are serious neurological symptoms. If you develop a severe headache after a head injury, even if the injury seemed minor at the time, you could have internal bleeding or a concussion. Headaches that progressively get worse over days or weeks, especially if accompanied by nausea, vomiting, personality changes, or memory problems, could indicate increased pressure in your skull from conditions like brain tumors or fluid buildup. New onset of severe headaches after age 50, headaches that are triggered by coughing, sneezing, or physical exertion, or headaches in people with weakened immune systems or cancer history, all warrant immediate medical evaluation. I cannot stress this enough. If you experience any of these warning signs, don't wait. Don't try to tough it out. Get to an emergency room immediately. Common triggers and lifestyle factors. Let's talk about the common triggers and lifestyle factors that contribute to headaches, because understanding these can help you prevent many headaches before they start. Dehydration is one of the most common and overlooked causes of headaches. When you don't drink enough water, your brain tissue actually loses water and shrinks slightly, pulling away from the skull and triggering pain receptors. Always keep yourself well hydrated throughout the day. Poor sleep is another major trigger for all types of headaches. Both too little sleep and too much sleep can trigger headaches, so maintaining a consistent sleep schedule is important. Skipping meals or going too long without eating causes your blood sugar to drop, which can trigger headaches. Eating regular balanced meals helps prevent this. Excessive caffeine consumption or sudden caffeine withdrawal causes what's known as rebound headaches. If you're a heavy coffee or tea drinker and suddenly stop, you'll likely experience severe headaches for several days. Screen time and digital eye strain are increasingly common causes of headaches in our modern world. Staring at computers, phones, and tablets for hours without breaks causes eye strain, neck tension, and headaches. Follow the 20-20-20 rule. Every 20 minutes, look at something 20 feet away for 20 seconds. Poor posture, especially forward head posture from looking down at phones, creates muscle tension that leads to headaches. Stress and anxiety are perhaps the biggest headache triggers of all. Finding healthy ways to manage stress through exercise, meditation, hobbies, or talking to someone is crucial for preventing stress-related headaches. Prevention and management. The best way to deal with headaches is to prevent them in the first place. Keep a headache diary to identify your personal triggers and patterns. Write down when headaches occur, how long they last, what you were doing before they started, what you ate, how you slept, and your stress levels. Over time, patterns will emerge that help you avoid triggers. Maintain a healthy lifestyle with regular exercise, which releases natural painkillers called endorphins and reduces stress. Practice good sleep hygiene by going to bed and waking up at the same time every day, even on weekends. Learn and practice relaxation techniques like progressive muscle relaxation, deep breathing exercises, meditation, or yoga. These techniques help reduce muscle tension and stress that trigger headaches. Stay hydrated by drinking at least 8 glasses of water daily. Manage your environment by reducing exposure to bright lights, loud noises, and strong smells that might trigger headaches. Consider supplements like magnesium, vitamin B2, or coenzyme Q10, which some studies suggest may help prevent migraines, but always consult with a doctor before starting supplements. Understanding your headaches is the first step toward finding relief and improving your quality of life. Whether you suffer from occasional tension headaches or debilitating migraines, remember that you don't have to just live with the pain. There are effective treatments and prevention strategies available, and working with healthcare professionals can help you find what works best for you. Pay attention to your body's warning signs and never ignore severe or unusual headaches. If you found this video helpful, please hit that like button and subscribe for more health content. Share this video with anyone you know who suffers from headaches. You might help them finally understand what's causing their pain. Drop a comment below and let me know. What type of headaches do you deal with and what remedies work for you? I love hearing your experiences. Thanks so much for watching, and remember, your health is your wealth. Take care of yourself, and I'll see you in the next video.